medical perspective.
Okay.
As to when and why
smoking is
the
substance in smoke that has been found as well as most addictive is nicotine.
We should recall in Nigeria
Nicotine
during the
drug addiction or drug abuse
and the analog
indiscriminate use of drugs.
sometimes even designed for first
yes, there's a link between malaria and
Excessive drinking water and the spread of cholera.
hospital. Let me even start this to make it more clear. Just
If you want to be theoretical, it applies to even men.
well,
In practice,
the chief servant.
This is MediShow.
Kidney failure is a life-threatening disease in which the kidneys fail to adequately filter waste products from the blood. This disease could be reversible with adequate treatment and often not reversible due to an underlying cause. In 2013, it was observed that 23% of Nigerians suffered from various stages of kidney disease. That is, 1 in 7 Nigerians suffered from chronic kidney failure. Despite the severity of this disease, Nigerian patients are faced with many challenges in terms of treatment. To this end, what measures have been put in place by the government as well as clinical advice to help reduce this disease? On our show today, we have Dr. Isah Umar, consultant nephrologist, the acting chief medical director of IBB Specialists. You're welcome to MediShow.
Thank you very much.
So, kidney disease is a life-threatening disease, and many Nigerians are faced with the challenges in terms of treatment. What would you say is kidney disease or kidney failure?
Kidney disease, by definitions, means a disease that affects the kidney, affect its normal function. If there is a reduction or a failure of kidney to subserve its normal function, that kidney is said to be diseased. If completely it has failed to subserve its function, the kidney is said to have failed. Kidney disease can actually be divided into two, where we can have what we call acute kidney disease. In that case, the kidney has been normal until that very eventful time when it suddenly lost its function due to a sudden disease entity that had affected it. This will last maybe 3 months or even less, and it will regain back its full function. Okay. Then we now have chronic kidney disease. That's a kidney disease that has persisted beyond 3 months. In that case, in most instances, kidney do not recover its normal function, and we said that is a chronic kidney disease.
What are the functions of kidney? How does it function?
Now, the normal function of the kidney is actually to handle the water and electrolyte balance in the body. That's the principal function, and that's why it's able to filter all the water that we take, all the water that is generated in the body, including the waste, and it excretes it as part of its second major function. So first is handling water and electrolyte, then excretion of the body toxin is also its function. Kidney also synthesize certain substances for the body use. It synthesizes what we call erythropoietin, and this is what the body uses to make blood. So once a person has a kidney disease, it means he will suffer from shortage of blood. Kidney also synthesize certain form of elements again that the body system use to build up the bones. So the strength of a bone depends on the activity, the normal function of the kidney. Okay, so kidney also detoxify, very importantly, all the toxins we take in the body, including medications. Most of the medicine we take are broken down and excreted through the kidney. The toxin we come in contact with, being natural herbal medication, bean sticks, snake bite, the marijuanas, those that smoke, alcohol and all that are actually eventually being handled by the kidney. You can see that the kidney has a massive functions in the body, and therefore its failure always portends a very bad outcome for the individuals.
What are the causes of kidney disease?
Now, kidney disease, unfortunately, the causes of the kidney disease are quite common, both the direct causes and then the associated risk factors for kidney diseases. So the commonest causes of kidney disease are what we call glomerulonephritis, and that simply means infections affecting the kidney. What are these infections? Within our environment, this is number one cause of the kidney disease. The infection virtually, as they affect the body system, eventually, as I've said, kidney handles it. So infection that affects the skin, infection that affects tonsils and all that can actually be handled or eventually get to the kidney, and they may cause what we call chronic glomerulonephritis.
But
it's a major cause.
Any infection that is in any part of the body?
Yes, also any infection that is in any part of the body, but majorly the infections on the skin, okay, and then the infection on the throat, what we call tonsillitis, are actually a major cause of the glomerulonephritis. Now, the second most important cause in Nigeria is hypertension. Hypertension is very common. The prevalence rate, though we don't have a community-based study, but the focus studies that have been coming up shows the hypertension as high as 24%, and in some centers it goes as high as 40% of individuals having hypertension. So hypertension is a very important cause. Diabetes mellitus is also a very common cause, and of course we know diabetes is quite common. And what we call obstructive uropathy, particularly in men, once you grow and then at the age of 45 to 50, you start having what we call prostate enlargement. That causes what we call obstructive uropathy. So it's also common among us, and particularly in the male. Of course, if a lady also has a problem within the urinary tract, it also falls within the same caption of obstructive uropathy. And of course, there are major causes of kidney failure. Then, for those that have family history of kidney disease, particularly, are also at high risk of developing kidney disease. Okay? And of course, if you have family history of hypertension, diabetes mellitus, it also means that you also have a high risk of developing kidney disease. Now, substance abuse. All sort of substance abuse, range from cocaine to marijuana, and that is the common we speak about, to as simple as cigarette smoking, are all known causes of kidney failure. In our environment, too, snake bite is also a very common cause of kidney failure. At least we had a patient who actually had to start dialyzing before he could recover, and that was just from the snake bite.
Anyone that have a snake bite can have kidney disease immediately, or for how long?
Well, those are the people that also have what we call acute kidney failure, meaning within the period, within 1 to 2 weeks of having the snake bite, person can actually come down with kidney failure. But the good thing there is, as soon as they recover from the snake bite, the kidney function might pick up, and they will probably never have any cause to have the kidney disease again. Okay. Now, the common thing that occurs commonly and people do not know is actually the skin lightening creams, what we call mercury containing skin lightening cream. They give it all sorts of names. They know this, not that, but it is known, since I have said earlier, that skin infection can actually affect the kidney function and cause kidney damage. It means anything that can cause irritation to the skin, which includes this group of pomade or cream, soaps, and all that. That is, all the skin lightening creams are a known cause of a known cause of kidney failure. The indiscriminate use of drugs. Pain relievers, you take this, you take that, concurrently for a very long time can actually cause kidney failure. And you know, it is a tradition. You will meet so many people, if they have a problem, instead of coming to hospital to have a specific diagnosis and treatment, you just walk to the nearby chemist and they will just jump all these painkillers, and that also predisposes them to kidney failure. So issues as simple as bee sting, just ordinary bee, can also result in kidney failure. Okay, and as simple as scorpion bite can also result into kidney failure. Then kidney stones, so many other things there. Then of course age. In terms of risk now, age, the older you are, the more likely you can have, or the more chances you have to develop the kidney disease. Particularly once you are at the age of 55, 60, you are actually at predisposition to develop kidney disease. Then Africa origin. If an African, in addition to the non-communicable diseases, were also exposed to kidney failure. And if you look around, hypertension, diabetes mellitus, they are all commoner in the black individuals compared to the Caucasian, and therefore, by translation, put us at a greater risk compared to the Caucasian. In fact, we're about 3 to 4 times higher in terms of the risk of contracting kidney failure compared to the Caucasians. So even our genetic makeup, our environment, and all that all contributes to increased risk in kidney failure. Another very important thing again is, of course, obesity. Very important. Obesity has actually been linked with kidney failure, and is linked with so many other things we have spoken about: hypertension, diabetes, and so many other related issues. So obesity is not a sign of good living, but it portends a danger to the individual.
What are the stages? What are the major stages of kidney failure?
Now, we have 5 stages of kidney failure. We have stage 1, stage 2, stage 3, stage 4, and stage 5. But what defines kidney failure, or if you like, what defines chronic kidney failure as stage 3, stage 4, stage 5? And what we use to measure these stages is actually what we call glomerular filtration rate. That is the percentage at which each of the glomerulus actually functions. So in normal individuals will have between 90 to 120. That's the normal glomerular filtration rate. Okay. Now, stage 1 means the individual has normal glomerular filtration rate, but has evidence that the kidney is diseased. Meaning, if you do laboratory tests like urinalysis, we must see evidence of that. Like we must see protein inside the urine, we must see blood inside the urine that cannot be explained by any other cause. That will now say this person has kidney stage 1, meaning he has a normal kidney function, but then there's a threat to the kidney already. Or we do abdominal ultrasound scan or CT scan or any other imaging modality and noted that kidney size has been distorted. We classify those people as having kidney stage 1. Stage 2 kidney failure is when individual has glomerular filtration rate between 60 ml per minute to less than 90 ml per minute. Those individuals are said to be in stage 2. Then stage 3 will have the glomerular filtration rate between 30 ml per minute to less than 60 ml per minute. That's stage 3. Then stage 4 will now be between 15 ml per minute to less than 30 ml per minute. That's 29 ml per minute or thereabout. Those are the people that has stage 4. And then stage 5 are those that have glomerular filtration rate of less than 15 ml per minute. And those are the stages. That's at the last stage. Those are the stage we call end-stage renal failure. Meaning at that point, that patient's individual's kidney can no longer carry him home, if you want to use it that term. Meaning it has lost all its excretory function, all its saltatory function, all its synthetic function. The kidney has lost that. And at that point, that person is said to have come to end-stage kidney failure, requiring intervention.
So, what are the symptoms of kidney disease? How do we identify the symptoms?
Again, unfortunately, like most of the chronic diseases generally, the symptoms might not really be noticed or noticeable by the individual sufferer or by even people living immediate with him. Most often, until the kidney function individual have lost more than 90% of his kidney function or her kidney function before he actually sought for medical attention. And in that case, at that point, it's almost quite late for something to be done tangible. So invariably, the kidney function is, invariably, the symptoms of kidney disease are not quite specific. But then there are some that will be a pointer to. Like for instance, individual wakes up in the morning and feels that his face is swollen. You wake up and your next door neighbor just, your face seems to be swollen. You are not even aware of that. And this will cleanse off, that's the puffiness will go off within some couple of hours or minute. And then those are the earliest things that might come. Then the individual may start noticing change in urine color, i.e., the urine color goes to something like Coca-Cola water, that's not Coca-Cola or Martina, or it's actually a frank blood or a dark colored urine. That's an indication of kidney disease. Let me also emphasize here that the color of urine that is indicative of disease is not yellow urine. Yellow urine simply means you do not have sufficient water in your body. And you can understand this better during the fasting state. If you are fasting, by the time it's around 4 p.m. to that point and that, if you pass urine, it's as deeply yellow as you can imagine. So yellow urine is not a disease urine before people, because everybody will certainly have yellow urine if you have dehydrated. Okay, now then people, you start noticing reduction in the amount of urine. If you go to toilet before and you pass large volume of urine, all of a sudden that start declining to such an extent that if you go to toilet, probably your urine just come in trickles. That's an indication that your kidney is not actually functioning optimally. You can also have change in the duration and frequency of your urine. For instance, in the night, naturally, a lot of people do not go out to pass urine more than once or at most 2 times. But with onset of kidney disease, people go out to pass urine severally. So at any point a person goes to pass out urine in excess of 2 times, he should actually go to check his kidney function and other disease entities like diabetes, and then of course drugs. Except if you have medication, certain form of medication for hypertension can actually cause increase in the urine output. So you should also have that at the back of your mind. Okay, now the person will have the sleeplessness, disturbed sleep, is restless at night, is not sleeping, is having nightmares, terrible ones, very often. It can also be an indication for kidney disease. Okay, and then there will be vomiting. Those are the tail ends now. There will be vomiting. There will be pruritus. What you call pruritus means there will be itching. All body will just be itching, scratching the person, and then the person have to. Will be itching the person, and then he has to be scratching. Okay, and then vomiting can be quite profuse. Then what we call hiccough. Hiccough is very common in people that have kidney disease, and quite disturbing. So this could also be part of this that may also stop them from sleep. Then body swelling. Initially, I said face swelling of the face, but body swelling at a point it becomes a sign and then the symptoms of kidney failure. I.e., the person will just come back and all of a sudden, he that have been of his normal body size just notice that the whole of his body just swelling. A person can also come with what we call an asaka. He can come with that. And then another form of kidney failure, which we call nephrotic syndrome. Characteristically, patient feels nothing except that swelling. He's just bloated everywhere.
So how is kidney disease treated?
The treatment of kidney disease, we can just look at it on 2 perspectives. First, a supportive treatment, and second, definitive treatment, or what we call cure. In court now. Now, if person approach or got to stage 5 where kidney has lost its function, then certainly the person will go for the kidney, we need treatment. So what we do importantly is what we call kidney replacement therapy.
Okay.
And kidney replacement therapy means dialysis and kidney transplant. Then the dialysis will have 2 forms, major forms, which we have what we call peritoneal dialysis as well as hemodialysis. What we have in our center is hemodialysis. Peritoneal dialysis means instead of connecting to a machine, just what we do here, for the machine to do the cleansing, we instill this cleansing fluid into the individual's stomach, and he goes about with it. Now, the hemodialysis is extracorporeal treatment, meaning we connect the patient to the dialysis machine, and the dialysis machine cleans the individual's blood and then return it back. And at each section of the dialysis, a patient will stay for about 4 hours on the machine, and machine keep cleaning and recycling the machine, the blood until 4 hours, where we expect that the blood is sufficiently clean enough and the person is disconnected. For a patient to stay alive and good, meaning functional, that the functional performance is not affected, he need about 3 sections in a week. At least 3 sections in a week, at least 12 hours of this machine-driven cleaning of the blood for every week. Individuals that maintain 3 sections in a week, they can go to do any job, they can go to their offices, they can go for sporting, they can do that, meaning they're as good as. Now, the other supportive treatment, which are geared specifically toward targeting the various functions of the kidney, as I've mentioned earlier. Since kidney have failed, that means even those functions have also failed, meaning there will be shortage of blood, so patient is given treatment to beef up his blood level, that's the PCV level. And we do this by giving an injection that we call erythropoietin. Erythropoietin, if you remember, I said is part of the synthetic function of the kidney. So we have injection that we give to cover for that. Then we give other supplement for the bone, that's to bone remodeling, so that the bone will keep being strong and all that, so that the person does not suffer from bone diseases. We give that. And we also have to give multivitamin to stimulate the person's appetite for him to eat correctly and appropriately. Okay, so those are some of the supportive treatment. Both the dialysis and this I've said are more or less effective, because dialysis is not a cure. Now, in terms of cure in the sense that once we're able to transplant patient, at that point the patient goes back to normal.
What measures have been put in place by the state government to intervene for those who suffer from kidney disease?
Government of Niger State, under the leadership of Chief Servant Dr. Isah, has actually done a lot for the people that are affected with this particular disease. If you remember, he set a dialysis center at IBB here, which I actually pioneered. And it's quite a good center, because for a center that is just starting to have the kind of facilities we have is not quite common. What he did is he provided us a machine, about 8 brand new dialysis machine, and then a very beautiful water treatment unit with state-of-art equipment. We also have a side lab, e-library, and of course a reuse room. As at the time the facility was established, it costed the state government over 83 million naira. That was a huge sum money to establish that. But it did not also stop there, because the cost of dialysis virtually everywhere is quite exorbitant. He actually gave a 40% discount for the patients. So right now our patients pay 15,000 naira per section of the dialysis. But what I want to add is that even at this 15,000 naira, of course, if I say that is going to cost them 45,000 naira per week for a section, for a patient, you know that is quite exorbitant and out of reach of an individual. We've not spoke about the injection. I spoke about, I say erythropoietin, which is going to cost another 15,000, another 6 times 3, 18,000 naira per week and all that. Therefore, even at this 15,000 naira subsidy by the government, he has actually done a lot, but that is not sufficient for the patients. And therefore, everywhere in the world, health services generally is not left into the hand of the government alone. And particularly when we're talking of chronic disease management, particularly kidney failure. So we're using this media to actually call on individuals, that's the public, individuals, the philanthropists, to come to the aid of these individuals by assisting us to buy consumables which we could give to them at a more subsidized rate or even free, depending on whose whatever wish. So thank you very much.
Prevention is the best chance of maintaining kidney function. Controlling of high blood pressure and diabetes can help decrease the chances of having kidney disease. Like we've heard it all from Dr. Isah Umar, that we should eat good food, involve in regular exercise, and then seek medical attention, avoid self-medication. On behalf of my group, wishing you a wonderful time. To the same time on the show, I am Imelda Isin. Remain blessed.